Hello, my name is Emily Grace McCarthy, and we need to talk about amplified pain syndrome. I'm an 18-year-old female who is currently diagnosed with POTS, EDS, and MCAS. These are acronyms, but for the purpose of this video, I'm going to use these abbreviations. But if you are curious about these conditions, I will have info linked in the description box below, and anything that I do say will be backed up with resources that will be linked below, as well as documents that are directly from my appointments from the hospital, and they will be scanned for an open document so that this is information for everyone to see. I am reading from a script just because I don't want this video to be 20 minutes long, but it's only going to be for the first half of the video, and then the second half will be me reading directly from paper documents and a website. I have my laptop here in front of me, so if you see me glancing down and not making eye contact, that is why. I do have POTS, which does affect memory function, so I can't memorize all of this as much as I would like to. Quick summary of my visit at CHOP's rheumatology lab run by Dr. Sherry. I was initially referred 2 years ago by Dr. O'Grady at CHOP in Chalfont location, PA, Pennsylvania. O'Grady diagnosed me with EDS, Ehlers-Danlos syndrome hypermobility type. He saw me for years but never did any testing or anything for my EDS except prescribed physical therapy multiple times, and I would come back after doing this physical therapy. I still had joint pain, and it actually worsened my back and my neck pain because I was being strained even though I was, trying to communicate. These exercises aren't working for me. I went back and I was still having problems, and it was then that he recommended me to rheumatology to rule out other possible factors. We arrived to the appointment, everything was normal. It was just another doctor's appointment. I was weighed, my blood pressure was taken, my height, standard stuff. Me and my mom were then taken to the back of the actual doctor's room, and we waited probably something like 30 to 40 minutes before we were actually seen by a doctor. That was off the bat kind of unprofessional, but then enters two doctors. I don't recall their names. One was a woman. She didn't say a single word while she was there. She didn't say hi, she didn't say how are you, she didn't say why are you here, she didn't ask me any questions. She stood in the corner like some Blair Witch extra looking at the floor, but she refused to make eye contact with me. And this visit didn't last very long, like a maximum of 10 minutes. But during that entire time she would not take her eyes off her shoes. She gave guilty or upset vibes, but I didn't think much of it because the man, he was severely cross-eyed, and that was distracting me. So during that entire time, the man, he squeezed my fingers and asked me if my joints were swollen, which I don't know how to respond to that because how do you tell if your joints are swollen? I said I don't think so. He listened to my heart and my breathing very quickly. When I answered that I didn't think my joints were swollen, he said, well, it can't be arthritis then. And then he moved on to not ask anything about our family history. Somewhere in the visit, my mom brought up that I have EDS, was recently at this point diagnosed with POTS by Dr. Boris at the same Chalfont location. They didn't say anything in response, but they proceeded to pull out a protractor device and asked me to open my mouth as wide as I could. Complied, and they took the measurements, and that was the only piece of data that they wrote down from the visit. He takes a step back and he throws up his hands and he goes, well, you have amps. And we obviously have never heard this before, so we asked what it is. He proceeds to stand really close to us. I mean, he literally was cornering us. This room, by the way, was no bigger than a small walk-in closet. I mean, it was very tiny, and he's literally just like leaning into our space. He's very tall too. It made me uncomfortable. Right away, a lot of red flags are going off, but we asked what this is. And you can tell it's completely rehearsed. This whole explanation of what amplified pain syndrome supposedly is. The whole time he's being really vague and using large words and overcomplicated language. The gist of what he says is, we don't believe in POTS or EDS. That's quote unquote. They told us straight up, we don't believe in those diagnoses. And they said that the underlying cause of my pain was overactive nerves. We're still at this point, believing what they're saying, maybe a little bit suspicious, uncomfortable the whole time, of course. But, we're like, okay, overactive nerves, what's going on? He proceeds to tell us that my nerves were converted from normal pain signals into amplified pain signals as a result of psychological trauma or stress. When you go into a doctor's office, you believe that they have the best intentions for you. You believe that they're there to actually help you. You believe that they believe you. So my mom, she steps in and she asks if they're implying that the pain is all in my head. And at this point, this dude, he waves his hands and he goes, oh no, the pain is absolutely real. There's just more pain presented that we can find than we can find evidence for. And it is bullshit because I didn't go in there screaming about pain. I didn't say, oh my god, my neck hurts every day and I'm crying. I came from Dr. Grady because physical therapy, my body wasn't responding to it because I have a collagen disorder. But this is just where things get 100 times worse because the guy starts explaining the AMPS treatment clinic. He claims that these overactive nerves can be reprogrammed by going off all medications that you are on. The second treatment method is intense exercise for multiple hours. They made sure to specify that it was every single day and to the point of sweating and breathlessness. They said that if I was having pain, which later I was diagnosed with fibromyalgia, but they said that the pain upon touching in certain sore spots on my body were due to overactive nerves, and the way that they would cure that would be to scrub me with steel wool to reprogram these nerves. To the point of pain. They made that very clear, and then the last treatment option was psychotherapy. We were told that if I were to attend a clinic, I would not be allowed any phone or any technology. I would not be allowed to call anyone. I would only have one phone call per week. And schooling. They said that my schooling would be completely controlled by them. My mom would have to sign over all medical and school responsibility, authority, everything. And they also said that they didn't recommend cyberschooling. They asked me if I had any friends. They made a point to ask me if I had any friends. At this point, my mom made a nervous joke about them keeping me, and the guy with the severe cross eyes, he says, oh no, we wouldn't take your child from you or anything. And tried to reassure us that I wouldn't be, taken. At this point, the visit ended. They sent us home with some papers, which I'm going to read in a moment. And I'm just going to read the parts that I highlighted for the sake of time. There's a lot of subjective language in here. There's a lot of claims with no evidence backed up. There are no citations, really. There's amplified musculoskeletal pain. Amplified musculoskeletal pain, AMP, is a very painful medical condition. It frequently affects a limb, but can also cause pain anywhere on the body. And the pain all these children experience, however, is much more intense than one would normally expect because the pain signal is amplified. I prefer the term amplified musculoskeletal pain since it refers to the fact that the body takes a mild pain signal and makes it very painful, similar to when a guitar amplifier takes a soft sound and makes it very loud. Many names may include reflex sympathy dystrophy, RSD, or reflex neurovascular dystrophy, RND, complex regional pain syndrome types 1 and 2, hand syndrome, localized or diffuse idiopathic musculoskeletal pain, neuropathic pain, central sensitization pain syndrome, fibromyalgia, algodystrophy, psychogenic pain, or psychosomatic pain. All of these things they are claiming they don't prefer to refer to by their names because they say that it actually falls under AMPS. All of these conditions are, according to them, considered AMPS. Information in the literature on the internet can be quite confusing. Most of it applies to adults with specific syndromes, especially the terms fibromyalgia and reflex sympathy dystrophy. The term sympathetic can be mistakenly construed to suggest these children are just looking for sympathy. We avoid using the terms RSD or fibromyalgia except in research purposes. Various forms of AMPS can coexist in the same child, or if there's a reoccurrence, the second form may be different than the first form. Again, it's a lot of nothing, a lot of not saying much at all. A pictorial representation of the overlapping nature of forms of AMPS is shown below. And then we see this quackery. So you can pause and look at that if you want to. We want to emphasize that all amplified pain is severely painful, and we are not sure which one hurts any differently or more than another. At times, the part of the body with AMP will become cold, blue, or purple, even swollen due to decreased blood flow, highlighted, although there is no specific test for AMPS. The next paragraph says, what causes the abnormal reflex? There are 3 major reasons for abnormal reflex: injury, illness, and psychological stress. There may be other reasons such as age, genetics, or hormones. 80% of children with AMPS are girls. Notice the patronizing ouch with 2 exclamation points. Okay, so what kind of injuries lead to AMP? The cause of AMP, approximately 10 to 20% of children, is injury. The majority of children with post-traumatic AMP have a significant specific injuries. Commonly, the injury begins to heal, and the pain starts to continue for weeks to months after the injury has fully healed. AMP can mimic previous pain experiences, e.g. feel like a broken bone, even if the bone has completely healed. Constipation can lead to amplified abdominal pain. In at least 80% of children with AMP, psychological factors seem to play a role. Notably, we use the term stress very broadly. Stressors can be positive, negative, big or small. They can include not just events, but feelings and personality styles. Many of the stressors that impact AMP are normal, again, that's a judgment, everyday stressors that all children face. Unfortunately, children with AMP tend to experience these stressors in their body as pain. What they just said there is the definition of a conversion disorder, while they say out the other side of their mouth that it isn't. While other children may show their stress in other ways, one major stressor we see in children is the psychological consequence of having such severe pain. This frequently is due to others not understanding the nature of their pain. Many friends, teachers, and family members do not believe the pain is as intense as it is, and also have a delay in diagnosis and multiple failed therapies. It is very frustrating. Additionally, all change is stressful, even a change for the good. Feelings such as worry, fear, and shyness are stressful, and these stresses of the events occurring, as are the stresses of events occurring in the world. So they're saying that not only your personal events can cause psychological stress that trips off AMP, but you could be watching the news and see something about global events, and it could trip off AMP. The most common stresses we see in children are those that arise from family and school issues. Many families undergoing changes such as an older sibling leaving home, new jobs, or marital issues. School is more demanding. Peer pressure, social demands, and social networking can be quite intense. Many children do not like conflict and have difficulty expressing their opinions, asserting their needs, or saying no for fear of upsetting others, which can also lead to stressful situations and experiences. Developmentally, most children with AMP are gaining more independence and responsibilities and may be going through puberty, which also increases stress. Some children cope with the stress by keeping it inside, and this stress can lead to bodily symptoms including AMP. Is AMP all in my child's head? No, not at all. The pain is very real and intense. Even in those children for whom psychological stress is a trigger or complicating factor, the decreased blood flow to the area of AMP causes extreme body pain. What are conversion symptoms? Conversion symptoms occur when a subconscious emotional self causes nerve activity or inactivity. The classic example is a girl who suddenly goes blind after seeing her dog get run over by a car. In such a situation, the girl has no physical problems between her eyes or her brain. However, the stress of her experience disrupts the communication between her eyes and brain, resulting in the experience of blindness without true structural damage. Sometimes the conversion symptom is more of a problem than is the pain, and is therefore best addressed in a treatment center with a focus on conversion rather than pain. The vast majority of these symptoms need to be ignored, since calling attention to them tends to make them worse. Conversion symptoms that are very entrenched and hard to break generally bespeak the fact that stress is playing a large role and needs to be addressed before conversion will resolve. Whether it is short or long-lived, it is important to remember that conversion is subconscious and not voluntary. Up to 40% of children with AMP will have at least one conversion symptom. Are there any laboratory tests to prove that it is AMP? No. What can be done to help my child? It is most important that someone with AMP begin to use his or her body in a normal way. The abnormal reflex is broken by intense physical occupational therapy. Some children are able to do this on their own by exercising at home. Although it hurts more to do the therapy, it does not cause damage, and some children are able to work through the pain. Many children will need to participate in an intense PT-OT therapy treatment program. It just hurts too much for them to do it on their own. Our intense program affords each child 6 hours of daily PT and OT, along with psychological evaluation and support through psychotherapy and creative art therapy. The duration of the treatment is impossible to predict unless we see the rate of your child's progression. Once in the program, we decide discharge goals on a weekly basis. Are parents allowed in the exercise sessions? No, we have not found that parents should be present. Children often respond differently in a parent's presence. We find it important to help children gain confidence in their abilities to cope independently, and we emphasize their independence throughout our treatment. While your child is being treated, we encourage parents and families to go about their usual activities as much as possible. Can parents eat lunch with their child? Parents are allowed to have lunch with their child on the first day of admission only. School is put on hold during the program so that he or she will not be overly stressed and overworked. We will contact the school or do a psychoeducational evaluation to ensure that your child's educational goals are appropriate. What happens if my child gets sick or injured? We will fully assess the nature of your child's injury and treat it appropriately. We want to see your child, even if he or she is thought too ill to participate. It is not uncommon for a child to have a minor injury and develop AMP in the injured area. Occasionally other issues, unable to cooperate, death in the family, severe depression, or suicidal ideation arise that require the child to leave the program early. So there are children who become suicidal in this program, is what they are admitting here. Children who leave the program early can be readmitted once everyone is convinced it will be successful. The type of therapy needed is different from what most physical and occupational therapists are taught. Most local therapists are not able to deliver the amount of therapy required. Are medicines used for pain? No. Most patients take no medication to treat AMP because it seems to hinder the retraining of the nerves. Other pains, such as menstrual cramps, are treated, but these two can become amplified. How can I prevent AMP from happening again? Your child is going to have illnesses, injuries, and psychological stress in the future. We do not suggest avoiding activities or situations that may involve stress or injury based on the fact that your child had AMP. It is our goal that your child has learned to work through these pains early on and has gained the coping skills to handle stress in a more constructive fashion. However, if your child starts to have excessive increasing pain, you should suspect AMP. It's important to not reinforce the sick role. When a child is hurt or in pain, the normal response is to give sympathy and make allowances, such as not having to make their bed if they have a broken arm. Children in chronic pain, especially AMP, either consciously or unconsciously receive benefits. It is important for the family to stop enabling pain and disability. We want to remove any secondary gains or reasons for the pain to linger. Additionally, there are children who just need to be more emotionally ready to get better before they can fully benefit from our program. The long-term outcome. There are very few studies on the long-term outcomes. If psychological stress is a cause of AMP, we have seen children subsequently develop a wide variety of other psychologically driven disorders such as anorexia nervosa, bulimia, and other amplified pain syndromes. And suicide attempts. Yep, it says it right here. But the fact that they recognize that there are suicide attempts in children who come out of this is just absolutely, I don't understand how this is allowed. What is being done to find out more about AMP? And it reads, the first sentence, there are very few places doing research on children with AMP. The care of your child is not dependent upon participating. It's worth noting that it's 2019 now. And we have tried to get this bogus diagnosis taken off of my medical claims because I'm trying to sort out my things now that I am an adult, I am 18, and I don't want that following with me. So we tried to have it taken off of my record. March 4th, 2019, and upon review of your child record, our providers determined the information as written in the record is accurate and valid, and we cannot accommodate your request for an amendment. I titled this video The Cult of Amplifying Pain because that's what it is. There's not a drop of hyperbole there. A cult is defined as a misplaced or excessive admiration for a particular person or thing, and that's exactly what I've explained. After my visit at rheumatology, I developed a yeast infection, and I went to my primary care doctor, Dr. Pamela Harrington. She accused me in the office of always coming in with all these problems, and later asked me about my diagnosis of AMPS. We vehemently, me and my mother, we rejected this, and we rejected going to the clinic, which is when my primary care doctor started to almost shout us down and shaking her head, and she's going, I can't tell you how many people come in here with all these symptoms all the time, and they go into that clinic and they feel better. They come out and they feel better. She proceeded to have a full-blown argument with us. She defended Dr. Sherry's theory, and she pushed us back to seek treatment, implying that I was manifesting things like yeast infections and fainting and other things like that. It's disgusting. And I'm bringing this up because it's not just Pennsylvania, it's not just rheumatology, it's not just CHOP, it's spread to other places, it's going to continue to do so. And this medical following of Dr. Sherry and his theories have not one scrap of science to back them up. There was one study done several years ago with only about a number of 40 patients, and that's the thing that they are basing this entirety of this AMP diagnosis on. That's bad science. Unless you count that study done 20 years ago with only 40 patients, this isn't just bad science. It's an abuse of power. It's dangerously irresponsible, and it's group thought. This has gotten political to the point of pushing other doctors out of CHOP. I was officially diagnosed with POTS by Dr. Boris, a pediatric cardiologist, who has since left the practice due to career differences. There's other videos on YouTube begging for him to be brought back. I will again list them in the description, because Dr. Boris was the only doctor, and probably is the only doctor, that has helped me gain any sort of control over my disabilities. And the fact that he is now not seeing patients but gone from the practice is eerily timed with the revamp of this AMPS clinic. But Dr. Sherry claims that he doesn't believe in POTS because there's no quantifiable evidence for it, but that's just blatantly false. I'd like to bring that up. That is blatantly false. Unlike AMPS, a tilt table test measures a drop in blood pressure upon standing, and it can prove POTS. I firmly believe in amplified pain to be rooted in misogyny and sexism. Multiple times they bring up that it's female. It's at best lazy science, and at worst it's modern day hysteria repackaged. We have psychological stress from the illness. It's not the other way around. Here, I'm just going to go through the website. It's not titled AMPS. It's not titled musculoskeletal pain. It's titled stopchildhoodpain.org. And on every page, there's a button to donate. On every page, there's a button saying that it's tax deductible. And on the products page, which is one of the first buttons, you see 3 pictures of Dr. Sherry on a DVD case. It's in Comic Sans. This process is similar to scar desensitization when one has a painful scar and has to rub it vigorously as much as possible in order to settle down the nerves. That the child essentially cures him or herself by exercising and desensitizing through it. The pain not only controls the child, but it controls the whole family, and that control needs to be directly addressed and stopped. Just as the child has to use her mind to walk on a painful foot, that the family has to let go and let them walk on the foot without worrying about every new pain being a fracture or symptom. Additionally, it can help the family assess how the family communicates that, either appropriately supporting the child or reinforcing the pain or sick role so that it can be identified and addressed. There is a term, secondary gain, which means the benefit one receives from their illness or distress. Even though I am quite miserable when I have the flu, this is Dr. Sherry speaking, mind you. Even though I'm quite miserable when I have the flu, it feels good to have my back rubbed and have hot chocolate brought to me. There's an error here. Even if you are a stellar student, there is some secondary gain to not going to school and having to keep up academically. It's also stressful to be missing that schoolwork, so it's a real two-edged sword. I shit you not. This is a man who runs a clinic. This is a man who has a diagnosis that is recognized now medically that is spreading. This is a man who has a vanity project going on that is causing harm to real people. They end both of these pages with a paragraph titled Self-Injury. Children with amplified pain are prone to self-injury. The pain is so desperate sometimes, and injuries such as cutting or bruising oneself give some form of relief, as strange as that may sound. So adding an opinion in there at the end. This is an additional manifestation of the psychological distress the child is feeling and needs to be addressed with counseling. He lectures internationally on the topic over the span, and he ends it like this. Over the span of his career, he's treated over 2,000 children diagnosed with amplified pain. And they go into the mind-body connection being significant in children with amplified pain. There's a propensity for these children to have a placebo effect. There's a vanity project here. Again, I'll insert the picture of the doctor who does these stupid, poorly attended 5K walks and such. And of course, he has to be the first thing you see on the page for fundraisers. It is intense physical and occupational therapy without medications cruel, is the title of the page. At first it may seem cruel, but working through the pain not only saves the child from unnecessary risk and side effects of medications and procedures, but also gives them the tools to stay well without needing to depend on healthcare professionals should they have a reoccurrence. That is a run-on sentence. That's their opening volley. Amplified pain is much more severe, and the principle is like when your leg falls asleep. It hurts to walk on it, but the sooner you do, the sooner it feels better. So amplified pain is cruel, not the treatment, is how they end the first paragraph here. To hold on to the hope of yet another pill or procedure is, in effect, more cruel than a few weeks of intense physical and occupational therapy. The children going through the program say that it is hard, but not cruel. There's a great appeal to emotion here. It says, the healthcare professionals who work with these children are individuals who choose their career paths because they care about these kids. And they link a PDF from 1999 with only 103 children, and another study that they mention with only 70 children. A lot of people have gone through this clinic and come out and they have had damage from this. There was one woman who reported, and I'm not going to give her information or read it verbatim, but essentially she said that she had carpal tunnel syndrome because she had wrist problems, as I believe she had EDS. And they said, okay, your wrist hurts. Well, we're going to add more pain to that. The way they did that is they made her write 4 hours manually with a pen, I believe. For hours, she wasn't allowed a break. She was told to keep doing it even and push through the pain, and she developed carpal tunnel, and she went out of there and she had to get surgery for that. There was another story where someone reported seeing a girl in a wheelchair. She was wheelchair bound, and they forced her to, she couldn't use her legs. She was semi-paralyzed, and this person who was in there said that she watched them force her to slide out of her wheelchair onto the floor and scoot across the floor on her butt, and she was crying because there was so much pain involved in that, and they forced her to do that because they felt that would help. And then there's several people who said that Dr. Sherry himself claimed that he cut off his pinky or one of his fingers to prove his theory of amplified pain and that it doesn't hurt anymore, and he did that to prove his theory. So that is something that was told directly to somebody who went and got out of that clinic, thankfully, but while they were there, they had to hear that was what the head of this disturbing clinic was claiming. So that's all I have for this video. If you wish to come forward with your story or anything else, please leave a comment below or message me at my Instagram. I'll put it on the screen. You can DM me. You can request to be anonymous. We need to push back and raise our voices. We need to not suffer in silence, because this is obviously a very traumatizing experience for many people. There is damage being done both psychologically, emotionally, and physically. There's no shame in that, and if we come forward and express that this is doing more harm than help, maybe we can put an end to this madness. So please share this with someone. If you have a loved one who has a chronic medical condition, fibromyalgia, or really just anyone, even if they are able-bodied. So thank you for watching. Please share, please comment, please like, and I will see you guys next time. Hopefully with a more positive video. Bye.